Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, and welcome to episode 1. I'm so grateful that you're listening. I thought I'd start off this podcast with an introduction. I think it's important for you to know who I am and what brings me to this place, because if you asked me what I wanted to be when I grew up, when I was a little girl, I didn't say a lactation consultant. But I did know that I wanted to be around babies, or maybe birds or puppies or dolphins. So that was close. My official bio: I'm an international board-certified lactation consultant, IBCLC, certified nurse midwife, CNM, so many initials, right? I'm in private practice in Staten Island, New York. Tongue tie is the concentration of the lactation side of my practice. But I often say that I have a schizophrenic practice because I have two phases, or a bipolar practice, because there's two phases to what I do. I'm also educated in functional medicine and work with those suffering with hormonal, thyroid, or fertility concerns. But that's a story for another podcast. My 30-plus year career includes 28 years at Staten Island University Hospital in Staten Island. I started as an RN, and I just kept going to school, became a CNM, and then an IBCLC almost at the same time. At the hospital, I was the co-founder and coordinator of the breastfeeding initiative, and I worked in collaboration with the New York City Department of Health for 8 years on efforts towards achieving the baby-friendly designation. In 2015, I resigned my position, gave up catching babies, and established my private practice focusing on lactation, women's wellness, and nutrition with an approach that integrates the midwifery model with the functional medicine model. So basically, I've been assisting new families to breastfeed since 1990, first at the bedside and in the past years in the outpatient office setting. My unique qualifications as both a nurse practitioner, as a nurse midwife, and a lactation consultant give me the ability to diagnose and prescribe treatment protocols for breastfeeding management as an independent provider, which is really cool. So how did I learn about tongue tie? I am proud that I was a founding member of the International Consortium of Oral Ankylofrenula Professionals, called ICAP, ICAP. Through this organization and other networking groups, such as the IATP and the American Laser Study Club, I've gained experience with assessment, diagnosing, and treatment protocols for infants with tethered oral tissues, also known as tongue, lip, and buccal ties. One of my goals is to change the culture around infant feeding and wellness, one woman, one family at a time. And my mission is to support as many parents as possible in reaching their own feeding goals, mostly by empowering them. I am so fortunate to work in a collaborative referral network with a team that includes a laser dentist for phrenology, various body workers, and speech-language pathologists, feeding therapists. I run virtual courses for professionals and parents to learn about this topic, and now this podcast. You'll see links to my offerings in the show notes. Most importantly, I am a mom and, very recently, a grandma. What an adventure that has been. I'm happily married for almost 35 years, which seems unreal to me. Time really flies. We have 3 kids of our own, and we helped raise my sister's 4 kids, so lots of experience personally with babies over the years. My hobbies include reading, listening to podcasts, hiking in the woods or on the beach, bird watching, and hanging out with my dogs. I have 2 very spoiled Shih Tzus that basically run my life. I'm a lifetime learner. Honestly, I'm just about addicted to learning. I want you to know that I don't come to my work because I was perfect at any of this. As time goes on, I'm sure I'll have opportunities to share my own breastfeeding journey. For now, I'll just say I didn't get it all right. And what is right, in air quotes, changes every day. If you are a parent or an expectant parent, the most important message that I have for you is to follow your own instincts. Of course, educate yourself. Then, when you shut out all of the noise of the world and the internet and all the experts, you'll hear the voice that tells you what is right for you and for your baby. No one knows that better than you. Trust that. Now, if you're a professional who takes care of families during pregnancy or through the first years, it's so important that you are here. We just don't learn enough about tongue and lip tie and breastfeeding, or breastfeeding by itself, in general, in school. I didn't start out my lactation practice knowing about this, but I quickly realized that there were some babies that my usual lactation skills didn't help. So I kept searching until I found that there was a whole topic of oral anatomy that was missing from my education. It's vital to learn more than you were taught in your formal schooling. I get sad stories every day of families who are failing to meet their feeding goals, infants who are suffering because of missed or mistreated tongue tie. Families need you to understand oral restrictions. Over the next few episodes, you'll learn the basics of tongue tie, what an IBCLC is, and why, if you're a parent who's suffering with breastfeeding issues, you need one. And we'll have other introductory subjects, and then I plan to start having guests. My guests will be other providers, but also will include parents who have made this journey because they are the best experts of all. We will all learn together. If you are interested in being a guest on the podcast, shoot me an email at lisa@lisapaladino.net. Please follow Tongue Tie Experts on Instagram and join our Facebook group called Breastfeeding Tongue-Tied Babies. The links will be in the show notes. Thank you so much for listening and for being curious with me as we navigate this complex topic of tongue and lip tie in the breastfeeding infant. Tongue tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.